Welcome to our course on emergency medications. We'll explore some of the most common forms of medications you might need to administer in a life-threatening situation. As RUSD staff, it's your responsibility to ensure students stay safe and healthy during the school day, and even on field trips. At the end of this course, you'll be asked to fill out a form indicating you've completed the training. Our goal is for you to feel comfortable giving emergency medication in a high-stress situation. My name is Tanya Cruz, District Nurse here at RUSD. Let's get started. One of the most common health conditions you'll encounter are food allergies. When we have a severe allergic reaction, it's known as anaphylactic shock. This is a life-threatening medical emergency where immediate action must be taken. Our body releases chemicals when we encounter our allergens, like a bee sting or eating certain foods like peanuts or shellfish. Allergic reactions can occur immediately or up to an hour after exposure, but most reactions occur within the first 5 to 10 minutes. Reactions can range from mild to life-threatening, so it's important to act quickly. To treat anaphylactic shock, doctors prescribe epinephrine. This is typically administered through an auto-injector. You might know this as an EpiPen. Don't worry, administering an EpiPen is simple if you follow the manufacturer's instructions. Let's go over the most common type of EpiPen you'll encounter in our school settings. EpiPen auto-injectors come in 2 sizes. The yellow label is for adults or children 67 pounds and above. The green label is for children under 67 pounds. However, different EpiPen manufacturers might be a different color or style. Students' prescribed EpiPens will be in a locked cupboard in the health office. Or if ordered by the student's doctor, a middle or high school student may self-carry their EpiPen on their person. Familiarize yourself with your students who have life-threatening allergies and what they're allergic to. Your district nurse will have a care plan for those identified students, and you should have a copy for yourself and any substitutes. First, determine if anaphylaxis is suspected. Symptoms usually occur right after ingestion of the allergen or a bee sting or ant sting. Mild symptoms of anaphylaxis can include an itchy, runny nose, itchy mouth, a few hives and itching on the skin, and a common symptom is nausea with stomach discomfort. You need to keep a close eye on the student with these symptoms, as they might progress into more severe symptoms. You can always call the on-call nurse at extension 83021. We'll be happy to help you to determine if an EpiPen should be administered. Severe symptoms of anaphylaxis include shortness of breath, wheezing, repetitive coughing. They might appear to be blue or pale, feel weak, or even feel faint. Their throat can be tight, hoarse, and have trouble breathing or swallowing. You might see significant swelling of the lips and tongue. What started off as a few hives and redness on the skin may now become widespread all over the body. A very common symptom of anaphylaxis is vomiting and eventually diarrhea. Finally, some people can feel anxious and confused and feel that something bad is about to happen. People who have experienced anaphylaxis before know all too well the chain of events and become incredibly anxious and upset. It is important for you to remain calm and in control of the situation to not cause them further distress. If any of the following symptoms occur, administer the EpiPen and call 911 immediately. Difficulty breathing, difficulty swallowing, fainting, or convulsions. If in doubt, it's better to give the EpiPen rather than risk death. Here's how to prepare an individual who needs an EpiPen. They will most likely be in distress, so it's important to remain calm and reassure them that help is on the way. When preparing to administer the EpiPen, seconds count. Have someone help hold the student's leg to limit movement. We'll be administering the EpiPen on the student's mid-thigh area. The needles are designed to go through clothing, so there's no need to remove anything. Use the EpiPen that is prescribed to that individual student. If there's none prescribed, use the school's EpiPen. Get the EpiPen Junior or the green label for children 66 pounds or less. Get the adult EpiPen or the yellow label for anyone 67 pounds or more. When in doubt of the student's weight, use the yellow adult EpiPen. More is better than not enough. To administer the EpiPen, remove it from the plastic case by flipping open the cap. Hold the EpiPen with your fist, with the blue end pointed towards the sky and the orange end pointed down towards their thigh. Please note, there are no buttons to push. Remove the blue safety cap. Hold the orange end near the outer thigh at a 90-degree angle. Firmly push the orange end against the outer thigh until a click is heard. Hold in place for 3 seconds, then remove the EpiPen. Massage the area for 10 seconds, then call 911 or delegate someone to call if not done so already. Remember, when using a district phone, dial 9, then 911. Send the used auto-injector with the paramedics to the emergency room with a student. Note that if the reaction is the result of a bee sting, scrape the stinger off as soon as possible with a fingernail or plastic card like your name badge. Do not push, pinch, or squeeze the stinger further into the skin. This may cause more venom to be released into the student. After giving the EpiPen, take these steps. Have the student lay on their side and cover them with a blanket. Duplicate the student's emergency card for paramedics to accompany the student to the hospital. Follow-up medical care should be received immediately at the ER, as a second, delayed reaction may occur. Document objectively by completing a district accident report. Notify health services at extension 83026 or call your district nurse for a replacement pen. For some students, consider additional medications after EpiPen injection. Individual students may have an antihistamine such as Benadryl or an inhaler prescribed to them. These medications will be located in the health office medicine cabinet as well. We know this is a lot to take in. Don't worry, if you forget the instructions for giving the EpiPen, they're printed on the auto-injector itself. Make sure to download and print the resources at the end of this course for reference later. We hope you're never in a situation where you'll have to use an EpiPen, but feel confident that you have the skills to save someone's life. On behalf of everyone here at RUSD, we thank you for your time and commitment to keeping our students safe.